Cool. It looks like we are live. Hello, everybody. This is Gabrielle, your admin, and I am here with Dan from Fireside Strategic, and we are talking about something really exciting today, and that is about selling your practice. So, I know that a lot of you know that I sold my group practice in 2021. But I thought it would be interesting to have the opposite person here, the person who actually buys them and can talk about it from a different standpoint. So if you've got questions, put them in the chat below. I'm going to keep an eye on that on my phone. If you're watching the replay, make sure you put hashtag replay so that I get notified and I can come back and answer any of your questions. But Dan, tell us a little bit about yourself. Let's start there.
Yeah, I would love to. Hello, everyone, and thank you, Gabby, for having me.
Sure.
So, as Gabby mentioned, my name is Dan, and I have the weirdest background ever. I'm going to give you the basics on it. So, I am actually not a licensed clinician of any sort. I have a weird background, though, kind of at the intersection of law, psychology, and investing. So, I started my career at a very large law firm doing mergers and acquisitions, which kind of makes sense because I'm acquiring, psychology practices today. And so I worked at a very large law firm, and then I worked on the Shark Tank TV show for one of the investors there. So if you've seen the show, I used to work for Mr. Wonderful, and my job was to draft, yeah, my job was to draft contracts for some of the deals on the show, to do due diligence on the deals, and also to help some of the companies that we invested in grow. And one of the things that really caught my attention when it came to that side of the job was how companies that are scaling quickly, that are all of a sudden moving from 5 to 20 to 50 employees, how tricky it is to manage teams and to build culture. And so I noticed that so many companies were held back because of this. And owners felt an insane level of stress because they just didn't know how to build culture and manage teams. So I got really inspired to devote my career to those sorts of questions. So I left law, went back to school, went to Columbia and studied organizational psychology, and especially how organizational psychology and mental health overlap.
Mhm.
And this wasn't too long ago. This was 5 years ago, but organizational culture and its relationship to mental health have come a long way in 5 years. People are talking about it much more now that we've had a whole pandemic that has
Yes.
reshaped American workplaces, right? So I ran a couple of companies using that skill set, failed at one, grew and sold another. And then I knew, having had the journey of starting a company from scratch, that I didn't want to do that. But I'm a complete entrepreneur and can never work for anyone else. So I thought, okay, rather than start something new, I have to be an entrepreneur, but maybe I could buy companies. And so I started to do research on where might I want to do that? Where do I feel a sense of mission? And where do I see a business opportunity? And so I started doing research on independent group practices and started to see that there were other acquirers in that space,
Mhm.
and did some research to understand what might be different about what we might do. And I saw that there was indeed a good business opportunity. Then I also saw that many acquirers were frankly screwing up the culture of the practices they acquired. And that really hurt because organizational culture is everything to me. So I started to understand, how could we build a better mousetrap? Are there independent group practices out there that are run with really, really smart strategic culture thinking?
Mhm.
And I found a number of practice owners over the course of kind of traveling the country, and found that a number of them found that there actually wasn't in the long term a trade-off between profitability and people, that the
Mhm.
two can flow together in psychology, that you can build a practice by treating your people like gold. And in turn, your clinicians will treat clients and patients like gold. And
Mhm.
then you'll generate an endless stream of referrals, and it becomes this beautiful virtuous circle. And so our lead advisor today is a man named Dr. Michael Goldberg, who grew his practice to 25 million in revenue using that philosophy. And not only was his practice insanely profitable, but, and this is really cool, his clinician satisfaction was through the roof. So if you think long term, and this is really what inspires me to do the work that we do today, it's that there doesn't need to be a trade-off between profitability and people.
Mhm.
And so our social mission, beyond the fact we want to make a profit, we love money, we're unashamed about that. But our social mission is to fight clinician burnout because it's a huge problem of national importance. I'm sure you guys struggle with it, right? So really, really important that we retain clinicians in the practices that we seek to acquire, but also in the profession more broadly. So that's me, and that's our mission.
I just love that so much. And that's why I wanted you to come here and to talk to this group because burnout is at the burnout prevention, not actual burnout. Burnout prevention is at the core of everything that I do. And it's just really nice to hear that from your perspective as somebody who does acquire practices, that it's important to you and that you make sure that you keep that in place so that clinicians don't leave and they're not unhappy. And the culture piece is just really, really huge.
Yeah.
Okay, this is not really relevant, but I want to ask you.
Yeah.
Tell us, like, what was the coolest or like one of your best memories from working on Shark Tank?
Yes. Yes. Good question. Like some of my coolest memories. You know, what was really interesting was to see how the TV show thought. So back in those days, things were a little different than they are now. In those days, it was ABC. It isn't ABC any longer. But it
Yeah.
was really interesting to learn how ABC was thinking about the show. They were thinking about the show in a very entrepreneurial way.
Hmm.
And so in those days, you couldn't get on the show unless you bought the airtime from ABC. So all of the entrepreneurs back in the day, and this was 11 years ago, not super well known, but there's no harm in me saying it publicly. People would actually buy the airtime in order to get onto the show. And sometimes ABC would take equity in the companies that appeared on the show. So they were super entrepreneurial in how they were monetizing the brand even before the show became super popular. It's much more popular today than it was then.
Fascinating.
Mm, it is, isn't it? Yeah.
I mean, that's a great idea, though. Very smart of them. I love that.
I'm imagining they made some money off of that. Yep. Yep.
For sure. Very smart, though. Okay, thanks for sharing. I just wanted to ask. I know that is not relevant to, to
Yeah.
buying
We
and
can talk
selling
about whatever you want. It's all fun. Yeah.
And if anyone, I see like a bunch of people just hopped on. If you've got questions, just put them in the chat. I've got it open on my phone so I can see if there's anything that you want to ask Dan about selling your practice or buying practices. But I have some questions, of course, about that. And I guess the first one is, if someone is thinking about selling in the future, or maybe they want to
Mhm.
sell now, what advice would you give them on, maybe like the top three or the top two things that they should be focusing on or working on?
Great question. And the way I think about it is that you can bracket each of the things that one should do to prepare a psychology practice for sale into maybe three categories, two or three, depending on how you look at it. One is culture, one is finances, and other is operations. And sometimes we might group finance and operations together. But let's start with culture because we're a culture-centric acquirer. And really every acquirer, if they think long-term in this space, should be because it's a people-centric business.
Yeah.
So you need to understand your people. I think doing an employee engagement survey could be really smart to understand exactly where they are. Because
Mhm.
the biggest risk that I know I need to mitigate, and I think other smart acquirers want to mitigate, is are the people going to leave post acquisition?
Yeah.
Really important that they don't get alienated because really we're buying the practice in large part for the people that are there, right? So I would never buy a solo practice.
Yeah.
So if the people are going to leave, what's the point, right? That's the biggest risk I need to mitigate. Now, in most cases, we as acquirers would not interview the people before the acquisition happens. It wouldn't actually be disclosed to people in the practice that it's on the verge of being acquired. But what would be really smart is if you could show me, hey, I run an employee engagement survey. This is where my people are. And by the way, the people that have left over the last 3 years, this is why they've left. And this is the plan that we put in place to remedy that. So
Hmm.
if you mitigate the number one risk that people might leave, that would make certainly me and I think other smart acquirers pretty happy. So that's
Yeah.
number one.
Yeah.
On the financials, we want to have clear financials as much as we can. And that's financials are an art more than they are a science. Every financial statement is imperfect, but we want the financials to be as clear as possible. I can't tell you how many meetings I have had with practices in which, they know that we're having a conversation about an acquisition, and I can see they're fumbling with their QuickBooks on Zoom, and it's
Oh,
just not a great look,
yeah.
right? It's not a great look. So conveying you have some confidence in your financials, I think is a really good thing. And different acquirers are going to have different requirements, especially when it comes to minimum transaction size. So, a lot of psychology practices will say, "Oh, I'm considering selling."
Mhm.
And the reality is there are very few acquirers that are going to look at very small practices. And when I say very small, I'm really meaning kind of a minimum of 400 in profit after you've paid yourself,
Mhm.
right? Profit really is after you've paid yourself or after you've paid the equivalent of a professional manager to run the show.
Yeah.
So, and that for us, the absolute kind of minimum, aside from very rare kinds of specialized circumstances, which do come up, is 400, but that's on the low end. Most
Mhm.
acquirers, particularly if they're big acquirers, are going to want something much bigger than that. So, if you're in the range of 200 in profit, which is really quite common, I see a lot of practices that are there. They're
Yeah.
not quite ready in most cases for acquisition yet. There's this hurdle they need to get over where the owner is doing less of the work, right? This is
Yeah.
another thing that's important. If the owner is doing all of the work and the owner makes it clear that they want to retire, that's not a very attractive proposition, right, to
Right.
an acquirer. And I see practices trying to pull this one all the time. And I totally appreciate the sentiment. I run businesses before I'm really tired. And once I was actually able to sell a business that I probably shouldn't have. But the truth is it's a really difficult thing to get away with. And if you're speaking to a professional acquirer, that they are going to want to help you. I know I want to help clinicians that are burned out, either reduce their role or maybe leave the practice. We actually prefer that the owners and the founders stay,
Yeah.
which I can get into if it's interesting. But if it's a case where it's clear that the business isn't doing that wonderfully well, if you're below the profitability minimum and you're really tired, that's not an attractive proposition to an acquirer.
Right. Which is important to know. And that makes sense because I think that is something that I hear a lot when people are asking me about this or we're doing consulting about it or whatever, we're just talking, is that people think you just sign the paperwork. It's very easy. You get a check or a wire, and then you just
Mm-hmm.
are done and you ride off into the sunset and it's all done and that's it. And that's not how it works. And so if you are selling because you're burnt out, which I did, but you
Yep.
need to know that that's not the end, that there's still more work to be done. And there is a light at the end of the tunnel, but I stayed on for a year, and most people that I know who have sold in any other industry also end up staying on during the transition time too. But if you have more maybe information about that, Dan, or why you prefer that, or could shed some
Yes.
light on that, that might help people too.
I would love to, and I'm going to throw another suggestion into the mix, and that is, the more that you've thought about your role in advance, the more credible you will be in a conversation with an acquirer. So
Yeah.
if you go into a conversation with an acquirer saying, "These are the things I like about my business. My
Mhm.
burnout is a function partly of the misalignment I'm experiencing because I'm spending all day dealing with data. I'm spending all day dealing with insurance companies. Please have someone else deal with insurance companies."
Yeah.
To which I would say, absolutely, that's what we do,
Yeah.
right? We can deal with them and it's going to be much easier. So if you go into the conversation with an acquirer having thought through, I'm tired, I'm exhausted, something's not working, but you've thought through what isn't working about the status quo. And you can have a conversation with an acquirer to understand how could they make your life better without raising the red flag that the ship is burning and I want to jump off of it tomorrow, right? That's a
Yeah.
much more credible case. And so, very often for me, if it's a complete, I want to leave tomorrow, it is a red flag because it doesn't indicate to me that they have confidence in the practice, especially if it's a smaller practice. Our businesses are a reflection of ourselves in so many ways, right? And
Yes.
so, if you're exhausted, your practice might be as well. and then it's not the most attractive proposition in the world. So that's a big reason why we would like founders to stay on. It signals if the founder's confident, or if the founder sees us as an opportunity, yes, to inject new pace into the business, to inject new energy, but they're excited to work with us. That's a sign that they have confidence in what they built.
Hmm. I love that. That's perfect. What else do you think makes a practice attractive for somebody to buy it?
I'll give you some other examples. So a run-of-the-mill practice can change its attractiveness in a few different ways. There's so much innovation going on in mental health right now. So, I run into a bunch of practices that do innovative things with ketamine. I
Mhm.
run into practices that are doing innovative things with TMS. You know, if you are from a business perspective as well as a patient outcome perspective doing innovative things, you're going to stand out from other practices. And take TMS as an example. If we're looking at a commercial insurance practice and I'm expecting at the high end to see kind of 18, 19% margins, but then I see TMSs there, then it's more logical that the margins might actually be 35%. And if you've already done that work to bring TMS in, I can see not only are you kind of innovative in your thinking, but the business is much less risky. So again, the biggest risk is the people leaving, but beyond that, it's profit, right? So part of the reason that we wouldn't acquire in most cases a 200 to 300 EBITDA practice is that's a riskier proposition.
Yep.
So any acquirer is going to have a trickier time financing a business that's too small. But one of the ways that you can very quickly get your business above that $400, at least for us, minimum threshold would be higher margin lines of business. And TMS is a really, really interesting one that I think just not enough practices have. And sometimes it's misused, but the fact is for treatment resistant depression, there's a lot of really strong evidence in its favor, and it's great from a business perspective. So at least for us, it's a way to marry people and profit together.
Mhm. I actually had a client who he had treatment resistant OCD, very, very
Mm.
significant OCD, and I think it's not quite approved to use for OCD, but they did for him because his was so significant and it helped him really significantly. And I
Mm.
think that just in general, like people are looking for alternative ways to heal and are looking for TMS and are looking to ketamine and psychedelic assisted psychotherapy. So love that you are into that and that you're open to
Yeah.
it, and it does make it more attractive. Another question that just came through was, do owner distributions count across the profit of the company, or does that get added back in to make the 400K?
Yeah. So for us, here's the way that I would look at it. You might get slightly different answers for different acquirers, but when I talk about the 400K minimum, I would add back what it would take to pay a professional manager. And that might be less than your owner distributions. So, as
Mhm.
an example, let's say the business is at 600K in what I would call SDE, that's seller's discretionary earnings. So, that's before you pay yourself. But you're
Yeah.
used to paying yourself 400 a year. Okay. The number then goes down to 200. But let's say you leave or your role is changed. Let's remove you from the equation for a second. And let's say that to bring in a professional manager, it would only cost us 150. So then I could potentially, if I always have to think about replacing the functions of people that are leaving or finding ways to compensate, people that are in the practice to do the same function at a different price. But imagine if a professional manager only cost 150. You may be used to paying yourself 400, but if you're leaving completely and I can replace you with a professional manager for 150, then we might say that this is for our purposes a 450 EBITDA practice.
Mhm.
Hope that clears it up. So it really comes down to not necessarily distributions, but how much it's going to cost to replace the functions that are essential. And as we build a business plan, we want to get really crystal clear on once we acquire, what do we intend to do and how much is that going to cost?
Yeah. No, that is perfectly said. And I think very helpful and explains, because I get that question comes up a lot too about distributions and
Yeah.
owner salary.
Yeah.
Another question that we have that this has been asked a couple times actually. Someone DM'd me this on Instagram too. What might be different for a mostly private pay practice that wants to get acquired?
Okay. Okay. And by private pay, we mean self-pay, right?
Yes.
Yeah. All kinds of different acquirers out there, all kinds of different philosophies. If the practice is mostly self-pay, it wouldn't be for us. Our model is commercial insurance focused. So
Mhm.
practices that are majority government insurance or majority self-pay, we wouldn't look at. From our vantage point, they're a little trickier to scale, unfortunately. There's very creative things we can do with insurance that make commercial insurance our priority.
Mhm.
So self-pay practices often carry bigger risks when it comes to retention.
Yeah.
So imagine, and I see this in New York City or LA or bigger places a lot. You'll get a practice set up, and it'll be almost entirely self-pay, and the numbers might at first glance look good, but the reality is that a skilled psychologist is going to run the numbers eventually and sort of see, there's no insurance contracts, meaning there's no barrier to entry, right? There's no challenge of me needing to get my own Blue Cross Blue Shield contract. So I can go out on my own once the numbers look good enough. So as soon as the practice keeps getting to a point where the numbers are looking good, and then all of a sudden people leave, right?
Yeah.
So because the biggest risk we need to mitigate is retention, self-pay practices just aren't what we look at. And there's not to say that they can't be good businesses. Don't get me wrong. And there may be other acquirers. I can't speak for all of them that might do self-pay, but we don't do predominantly self-pay practices for that reason.
Yeah. Yeah, that makes sense. And that's what I've heard a lot of as well. We have another question,
Sure.
and well, you can answer this. Do you offer free consultations to look over finances to determine if they're ready to sell?
Yeah, so I am happy to meet practice owners. I can give my email, or Gabby and I can figure out the best way to provide some contact info. And if you shoot me a little bit of info about the practice, I'll be able to tell you, hey, it's worth our while to at least have a conversation.
Mhm.
And very often, even practices that aren't quite at the stage of a sale, it's just fun for me. This is what I do, so I'll very often just speak with practice owners, and I think I've spoken with like 20 over the past month or so. So I love to have conversations with practice owners. It's what I do. So the answer is yes. You don't have to pay me anything. I'm happy to have a conversation with you.
Well, thank you, Dan. 'Cause I know a lot
Yeah.
of people,
Maybe I should be charging. Maybe I'm leaving money on the table. I don't know, but I'll talk to you.
it'll come back to you. Karma is a good thing.
There you
Um,
go.
I also know I'll
You could
just
help me
say
reach Nirvana, right, Gabby?
exactly.
Yeah.
That's the goal. I know some people had reached out and they were nervous about coming on the live because they didn't want their name or anything on there for anonymity, which I totally understand. So
Absolutely.
um I'll put Dan's email in the chat box, and I'll also put my email in there too. If you have questions, you can just email him or me directly, and then you don't have to comment on here and nobody will see that your name was attached to it. So don't worry about
Yes.
that. We can keep it more anonymous, which is a good thing when you're in that process. You want to be careful about that.
Could I share one just quick thought on
Yeah,
confidentiality because it's very important?
yeah,
Totally appreciate the importance of anonymity in all of this. And please understand, if we speak at all about acquisition, there is an NDA signed, right? There's a non-disclosure agreement signed, and that isn't just your legal obligations, it's ours as well. So any conversation that we have about a specific practice, believe you me, it's completely confidential. Anonymity is super important. You've worked really hard on your business, and it's important that when you tell me about your business or I tell you confidential details about our business, we're both protected. So we have these conversations under a mutual non-disclosure agreement. So everyone's secrets are safe.
which is so important and a very huge part of all of this. If you are thinking about selling in the future, you will sign an NDA, and yeah, you want to be protected in on both ends. And it's really helpful that Dan is an attorney. So
Yes.
a little, there's like another level of protection there.
That's it. Non-practicing to be to fully disclose at
Clear
this point,
once.
but
Yes.
yes, I say retired or recovering lawyer sometimes.
I love that.
Yeah.
Okay. If anyone's got any other questions, put them below as we wrap up here. And again, I'll make sure that both of our emails are down here. If you want to chat with Dan about selling now or in the future, you can do that. He's at Fireside. It's firesidestrategic.com.
You got it. Dan at firesidestrategic.com.
Okay, perfect.
We'll put that in the chat.
Um,
Yeah.
cool. Anything else, Dan, that you feel is important that we didn't talk about?
Maybe just we talked about it a little bit at the beginning, but it's I think it's always just a beautiful thing to talk about why we do the work we do. And you know, the pandemic has sort of come and gone to an extent, right? We are still experiencing it. And I think mental health hasn't been quite as much in the news more recently as it was during the pandemic. I'm starting to see there's a little less attention.
Yeah.
All of the momentum that we built around reducing the stigma of getting support, not that none of it's there, but it's diminished a bit. And in many ways that's unfortunate. And it's just so vitally important, the work that you guys do. So I really applaud you for it. And mental health is the greatest source of disease burden on the planet. So this isn't just a business. This is an opportunity to do good. And
Yeah.
so I just so applaud everyone for doing the work of mental health. It's like about as important a job as you could do. So let's all do it well and be proud of ourselves for doing it.
We don't hear that enough. So I think I'm going to say I speak for everyone that we appreciate that because it's a tough job that we have and we don't hear that a lot. And I think, that's why a lot of us are so frustrated right now because of everything that's happened since COVID and the pandemic and the uptick in mental health services. But a lot of those resources aren't matching what's happening. And so, um, yeah, I think it's just appreciated that you said that. And I put both of our emails in the chat. So if anybody, again, if you're interested in selling now or later, you can reach out to Dan. It's Dan at firesidestrategic.com. You can go on their website and read more about him and the folks that he works with. And if you are watching the replay, don't forget to put hashtag replay so I can come back and make sure that answer any questions that you have. And I think that is it. I don't see anything else coming through the chat, but I really appreciate you being here with us and sharing all this really, really, really good info that a lot of us, I feel like, don't have as much access to. So thank you for that. And I think that's it. Anything else?
Not at all. Thank you so much again for having me. Really enjoyed the conversation as I always do our conversations, Gabby, and excited to talk to members of your audience when the opportunity pops up.
For sure. And I really hope this helped you guys and shed some more light about what it's like to sell a practice and also what somebody is looking for when they want to buy one.
Bye, everyone.
Thanks, Dan. Bye.